At the close of a 3-day symposium entitled Haiti and Dartmouth at the Crossroads, innovative thinkers from Haiti, academic institutions, and the medical community identified a trauma center as the highest healthcare priority in post-earthquake Haiti.
Haiti is a wonderful laboratory for thinking about science of healthcare delivery, for thinking about how you set up a trauma center where there is no one there who has done that.
Dr. Peter Wright, one of the organizers of the conference, says it's a project in which Dartmouth-Hitchcock could bring a lot of expertise to bear.
I think we can put together a team that can think hard about how big it should be, how can it be designed in a way that is sustainable.
Providing health care in Haiti has long been a struggle, even before the 7.0 earthquake struck on January 12th in 2010. The disaster would leave nearly 300,000 dead and more than 1 million homeless.
My personal house collapsed, and I was extremely lucky not to be in the house. I was very worried about my daughter and my grandson who was just born. We were very lucky, but we lost so many people.
Now, 3 years later, Haiti still struggles to recover, and former Prime Minister Michele Pierre says it's a painfully slow process.
There are plans being discussed, but at the same time, we don't feel the enthusiasm and the mobilization that the international community had right after the earthquake.
Haiti hit today by a powerful earthquake.
In the weeks after the quake, the Dartmouth community mobilized. Medical teams from Dartmouth-Hitchcock, along with tons of equipment and supplies, were rushed to the scene.
We have trauma experts, emergency medicine experts who went down after the earthquake and have remained involved.
The earthquake underscored Haiti's urgent need to rebuild and plan for stronger, healthier communities. The symposium, spearheaded by the Dartmouth Center for Healthcare Delivery Science, was aimed at moving that process forward.
What we wanted to do was help by using what I have referred to as academic capital, of using the brains, using the energy and initiative of individual people and of students to see what we could do for Haiti.
Music is at the core of Haiti's identity. It's long been a political force for change and an integral part of the culture. Musicians
express the voice of the people, and I think what's missing in a lot of the dialogue about the future of Haiti is the voice of the people.
Zach Niles helped bring members of the group La Coup Musique to the Dartmouth Symposium to provide that cultural voice.
Haitians are very, very strong. They understand the fact that we had an earthquake and things are not being done what they're supposed to be, but they still have hope.
That hope is reflected in their music.
The story, it's like, pour esquadio ka rassemble, for all the people to come back and rebuild what we lost and rebuild what we can rebuild again, and probably much better than it was.
Being at Dartmouth here today for this forum is important. We have to keep Haiti on the map.
I think truly that we need a step ahead. Not a big step, but we need to follow step by step and then see if we can go somewhere else.
Dr. Wright hopes the Dartmouth medical community can be a catalyst for that step forward. He concedes that a trauma center will require a lot of work, but he believes the commitment is there.
Brian Remillard should be singled out, Raj Gupta, Scott Rody, Rob Gougelet, who set up the emergency care systems throughout northern New England, I think are all people who both feel an attraction and an affiliation with Haiti, and at the same time bring a skill set to the problem.
So what is it about Haiti that elicits such involvement on the part of medical staff and the academic community?
It's a love of the country and the culture and what's there, and you have to go there to experience it.
You'd be amazed how people get to you. They're very, very friendly and very lovely, and we show that in the music too.